Now it is. Okay, great. We're going to go ahead and get started on our last event for the day. So for our final event, we're going to talk about broadening the focus, a fireside chat. And Annette James is going to be joined by Dr. LaShawn McIver. Dr. McIver is the Chief Health Equity Officer for AHIP and the former Director of the CMS Office of Minority Health. I'll leave it to you, Annette.
Thank you. And is this on? So, first of all, thank everybody for making it this far, staying with us all day. We really appreciate it. Dr. McIver, we've sat here and heard a lot of information. And to me, the most amazing thing about today is we've had so many different perspectives. A lot of health equity type events, we still break out into groups, right? And we have breakout sessions so we can all go in our little silos and stay there. Today was different. Mm-hmm. We had to break out of our silos. So with your background with AHIP, being the Chief Health Equity Officer, and working at CMS, what is your reaction to what you've heard today?
Well, I will echo your thanks to those who are here. We all know that you don't want to be the speaker between lunch, and you also don't want to be the last speaker of the day. But this was by design because, as Annette said, this is a unique time, and I'm really honored to be in a unique position in the healthcare system. I'm going to start with a few things before I give my reaction to the day, because this was an outstanding symposium. So I want to congratulate the Academy for having such a rich conversation. I know when I started this work, this specific work in the federal government 3 years ago, I often heard from the actuaries they didn't really know what they were going to do. Almost 4 years later, look at what you are doing. And this is advancing health equity. And so I want to congratulate you because the conversation that was had here today is how we will transform the future of healthcare. And so thank you for gathering and putting people in a room that may not typically be in the room. I didn't know you all were so exciting. When I started, actuaries didn't seem that exciting, but this is the necessary, this is the necessary work being done by amazing people across this country, and you also are a critical part of how we move this work forward. I will just, by way of introduction, share perspective. So as she said, I'm currently the Chief Health Equity Officer at AHIP, or it stands for America's Health Insurance Plans, and we're the trade association for the commercial health insurance industry, but also we have many different types of insurers represented in our membership. And we cover well over 200 million lives in this country, so many people are covered in this space. And so this role is to help drive an industry focus in this area, as well as to help shape the work that we do in this space. AHIP is known for our policy work and among many other things. And so now having someone in this role, I'm the first person that's in this role for the organization, it represents our opportunity to change history. Why? Because many policies have led to why we are here today. When you think about housing policies, health policies, educational policies, environmental policy, these things have led to these deep-seated inequities that we see across communities in this country. And so for organizations like AHIP that are responsible for developing legislative priorities and regulatory priorities and state-focused priorities, et cetera, we have an opportunity to help rewrite the future of healthcare by helping to advance this work from this space. Prior to coming to AHIP, I was at CMS as the director of the Office of Minority Health. And so earlier we heard about the gentle nudge of the federal government in this space. So please no tomatoes. Don't throw any tomatoes this way. But for CMS, our office, we took the agency on a journey, and I want to commend those who are doing that work across the federal government. Because the mandate to embed health equity in everything that we did when I was in the role, did as the federal government, that was a huge task, especially on day 2 when people said, well, what is health equity and how do we even do this? And so suddenly we had to activate the entire healthcare system, federal agencies, all these different sectors to do this work. And so when I think about this conversation today and why it is important, because we talked a lot about cost. The Commonwealth report that came out in January, it continues to remind us what's happening with cost. We are spending the most money on healthcare in the world in relation to other high-income countries, but the health outcomes in our country put us at the end of that list. We are consistently at the bottom of that list. So what are we actually paying for when we're paying for health care? And that came up in one of the discussions today about you're going to pay for it one way or another, right? So either you think about it strategically, or we are going to continue to pay these high costs. So those are just some initial comments that I wanted to make. But I have been feverishly writing notes and typing things all day because you all have, I think everything that needed to be said was said in the room today. Mm-hmm. And that's why I said this has been an outstanding discussion, because you covered I don't think there's a rock that was left unturned today. And it's very hard to bring different groups together and walk out with, you all have all the information you need to help us move this forward. But some of the things that I thought about based on comments today, this work is hard, right? We heard that today. This work is difficult, full stop. I know wearing the title of a Chief Health Equity Officer and at CMS as the Director of the Office of Minority Health, you're sort of up against generations of issues, right? And we talked about there's a whole ocean out there. And so sometimes it's discouraging because the work is hard. The solutions can be complex. That was something that was stated today. But there's also joy in what happens when we get this right. And it's an opportunity for transformation. And more importantly, what I want to reiterate is we're making progress. We truly are making progress. Because right now we're in an inflection point in the healthcare system. We talked about what happened with George Floyd. We've talked about what happened with the pandemic. And we've also talked about there's only a few times in history, and someone mentioned the political determinants of health. There's only a few times in history where you get an opportunity to change and make historic change. This is one of those times. It's happening now because we're transforming the healthcare system at the system level. There's many organizations that have been doing this work, but not at the system level. And so this is why the progress, it's exciting that we're actually making progress. Another comment that was made today is what we have is imperfect. So someone was saying, we have a lot of things, but it's not perfect. And I would offer also that where we are, it's not perfect. Like the place of where we are as a healthcare system is not perfect. However, we have enough to act, right? We've talked, the last panel touched on data and what data we have, what are the challenges and opportunities with that data. We may not have everything we need, but we have enough to act as we work to improve where we are. Again, I'm going to mention, I had written here about the gentle nudge and how, through some of the executive orders that are underway, it has sort of forced us to act. And what that made me think about as I listened to the discussion today, and something I've said before is we can't regulate our way out of where we are today. When we began this work at CMS, a lot of what we set was actually the floor to where we're building. And there's some things that the federal government will be able to do from a regulatory perspective or a policy perspective, legislative perspective, and think across all these levers of government. But there are other things that, from a business imperative perspective, we are spending trillions of dollars on healthcare. And again, the health outcomes. When are we going to solve that problem? And so we have a responsibility to think differently and act differently as a healthcare system. And you heard that today. You heard what it looks like when you start to think differently, when you start to ask questions that are leading to solutions. And so I'll just stop there in terms of reaction. But I think that the biggest takeaway from me today is this to me truly represents what progress looks like in this space, because you all are an important part. Every single person that's here is an important part of the path forward. So
Thank you for that. And so as I listen to you, I'm thinking, okay, so this is a start, right? And we have to start somewhere. And there are a lot of people doing a lot of things, and thinking differently is an important part of it. So my question to you is, how do we make health equity sustainable? How do we go about continuing the progress without getting discouraged? Without thinking about, we don't have enough data, we don't have the right data, we don't have, it isn't standardized. How do we make it sustainable?
that's a wonderful question, and it's a very timely and important discussion. There's a clock that's ticking in the healthcare system. We don't want to really say it out loud, but we know that some folks doing this work are trying to wait out a clock of what will happen, right? Do we make this investment now because of certain priorities through the administration, or do we sort of wait it out? Like, do we wait it out, or do we do the work? We don't like to say that out loud, but I hear it whispered in the hallways that this is a challenge, right? And so for people doing this work and investing in this work, that speaks to the very heart of sustainability, because there are key investments that are needed and being made at this moment that will help us actually transform healthcare. In the insurer space, what will happen 10 years from now if we continue on this path of designing coverage that is helping to meet the needs of the people that we serve? So we're here today, we're making progress today, but 10 years from now, we're talking, and we're still gathering data on what that looks like, and we heard that today, but we're talking about sort of the long-term effect. And so this whole idea of what is the cost now versus what's cost effective in this space. So for those who are doing this work, the angst that I hear that's underneath that question of sustainability is, there's a lot of changes being made now. Will this work continue? And so when you hear things saying that health equity is a priority, yes, it is a priority, but in order to sustain it, it has to become a part of the fabric of what we do as a healthcare system. And that's what it truly means to embed health equity into the work that you're doing, based on where you sit in the healthcare system. So in order to sustain this work, there's multi levels of effort that's needed. So often, and I've been very fortunate to talk to healthcare leaders across the healthcare system in many different spaces. And those who are most successful in this work right now, and we're doing this work well already, they had buy-in at their chief executive and board level, if that was their structure, for example. So having leadership actually understand what this work is and what it means for their business and the people that they serve, and being committed as an enterprise to do this work, I would dare say that's your biggest predictor of success and sustainability. And so as a healthcare system, we're not, as an ecosystem, we're not there yet, because we have those who are actually doing the work. Many, many companies are doing the work, some who are in the middle, and some who are just, either early doing the work in an early stage, or they're kind of just pausing because they don't know what happens if they move forward. And so having leadership that understands that this work is important, being able to make the economic case for why it is important and why it is a part of the mission of the organization is really important to the sustainability of this work, because you won't just see it as a priority that's here today and gone tomorrow, but you'll understand if you're in the healthcare ecosystem and you're using these words and doing this work, it's actually impacting the lives of people. So when we say we have the best X in the industry, you don't have the best X in the industry if you're not doing this work, because you're leaving millions of people behind. So we have to get to a point where we understand that when we're not advancing health equity, you're not actually delivering on what we're promising across all these business lines. And so that's not how we think about it sometimes. But for those companies that are understanding that and are starting at that level, that's important. So what happens when it's embedded at the leadership level, then it becomes a part of your enterprise strategies. Mm-hmm. So you notice I didn't say goals, right? Like, it is a priority, but it's now a part of what you do. And everyone should be able to look at their work and understand how their work advances the health of all that they're serving. One of the things that I was thinking about earlier relates to the definition of when I think about health equity and how we're trying to help people attain their highest level of health and well-being. So the question is, how are you helping people attain their highest level of health and well-being in the work that you do? And so that's a question we all can answer, right? Or should be able to answer. So for example, if you are a communications expert, oh yeah, we're in the press club. That's a great place. If you're a communications expert for your organization, you have a role in health equity. Why? Because your organization is controlling the message of how you show up in this space. So how are you thinking about health equity? Do you understand what it is? Are you partnering with the right people to help disseminate the right messages? Like, how are you doing that work? How are you sort of being measured of your success to do that? One question I will ask, some teams will say, well, we're having difficulties resourcing this work because that's a part of the sustainability equation. Are your financial teams involved in health equity? Do they understand what it means? What's their strategy to understand how we're leveraging our resources? And we heard today what happens when the actuary asks the question in the room, right? Like, when you start to think about it, what does that mean? And so embedding it into an organization is key. And the three things I'll leave you with is, one, it involves educating your leadership in your enterprise and your stakeholders on what this work is and why it's important based on where you're sitting in the healthcare system. Two, it was educate, embed. So the embed is what I talked about with the different parts of it, and resource. So if you say that health equity is important and that team doesn't have what they need, then it's not actually important, because they're not being resourced to do this work effectively on behalf of those that you're serving.
Yeah, that's a lot to think about. Thank you very much, Dr. McIver. And so, you mentioned earlier about systemic change, and that this is systemic change, and there are a lot of people involved in health equity, but not necessarily in systemic change. So what will it take to accomplish systemic change? Because you talked about sustainability and the importance of leadership in those efforts. But if we're talking about systemic change, to me, it's not up to one individual or one organization. It's broader than that. So what do you think it will take to bring about this systemic change?
That's a great question. So I think again, we're seeing it in action. It takes all of us to bring systemic change. We have the lightning bolt that we have in our hands right now is we have an administration that has prioritized it, and so across every sector of government, we're seeing how we're thinking about it from these types of institutions who are responsible for federal policy and federal programs and benefits and services. And that is driving, it's sort of been a ripple effect because it is driving other parts of the healthcare system to act. And we're seeing it at state government, at the state government level. Many states are doing incredible things in this space. Local government. I was in San Antonio a couple weeks ago, and in working with colleagues from Texas, it has been difficult for some of them to implement this work. And so San Antonio had their Health Equity Day. It was like their second conference, and the conversation that they had for that was so powerful to see, even in the context of there were some other challenges across the state, but at the local level, what they were able to do to push systemic change in their local government. And then systems, like the things that we talked about earlier today or on this last panel about addressing what we're seeing in healthcare, changing the system of how we deliver care is what I was going to say. We're changing that. That is, we're working on a system that has been hundreds of years in the making, right? And so the American Medical Association has done a lot of work in this space. Some of what was mentioned earlier about this. This is an important change. As a physician, one of the things that my medical program was one that focused on international health and medicine. And so we learned, cross-cultural medicine. We called it cross-cultural medicine at the time. And it was interesting because it was like, oh, okay, this is different, right? And it's not that long ago. I don't want you to think it was that long ago. But let's say 20 plus years ago. I just remember thinking, so I processed where we were, but then I went into the healthcare system. And the physicians, some of the training physicians, it was as if we were decades behind because of who was in leadership at that time. So you have a new generation coming into the system that is being trained by people from different generations who are processing this in different ways. But now, 20 years later, seeing how the institution of medicine is changing, how we deliver care. The topic of AI came up, which is very, very broad and diverse in what that term means and how work is being done in that space. But the rate at which that is advancing and the rate at which we are closing the gap on how do we make it better, it's not fast enough, right? Because the AI is outpacing our ability to actually design tools and all of these different things that won't actually do more harm if we are not successful at getting this right. So, and what I mean by that is a lot of it's being developed and then equity is at the end of that because it's not embedded into it. So just kind of walking through this, the systemic change is happening. And it's helping us as a collective to understand why it is important to keep it moving forward.
So the systemic change would actually fuel the sustainability of the change, is what I'm hearing. Did I get that right?
Yes.
Okay, so we heard a lot today about collaboration. So what are your thoughts about how we can collaborate with all the various stakeholders in the health ecosystem? That's a simple question, right?
That's very easy to do. Yeah. The biggest challenge is our healthcare system is fragmented on many different levels. It's fragmented from a, how we deliver care perspective, how we pay for care perspective. There's so many fissures in this current system. And so health equity has been one of the recent things that's helping us try and bring some of this together and sort of remove some of these barriers. It starts by conversations like these. Actually, you're doing what I usually leave as a parting word, which is look around in the room and see who's not here. Who wasn't here today that should have been in this room with you as we had this discussion? You actually had a very diverse room filled with stakeholders from different sectors. That is how we move forward in health equity. Bringing together stakeholders who can see it from many different perspectives to help us build forward. And as Dr. Lisa said earlier, and you can't forget the people who, she talked about people on the street and that whole conversation of health literacy. It doesn't matter your education level. A lot of people are struggling to understand their coverage under that health insurance literacy or health literacy bucket. But the people impacted by all of this good work we're trying to do, they're equally important in solving the problem to collaborate or bringing together. So it's through situations like this, bringing folks together. And I want to challenge you to ask yourself, like, what did I learn new today? And what am I actually going to take back to my organization and do something about? I'm sure there's something that all of us heard today that will challenge us to go back and do something about it. And so that's my sort of parting words to you is, there's no stone that was left unturned in this room today, so do something about it.
Okay, so Dr. McIver, that begs the question, what did you take away today that you're going to be able to take back to your organization?
So I took back, or I will be taking back to AHIP, that we need everyone in this room to help us get it right. I'm in the building phase for our organization. We've been doing health equity work for about three or 4 years now, really sort of focused work, but not at this level where we're trying to identify an industry focus. And so I'm currently working on our strategy for the organization that's going to focus on 3 pillars. The first one is all of the things that we as an organization need to do so that when we're continuing to show up in this space, that we can help really transform the future of healthcare through our policy and legislative efforts that are touching the healthcare system. And then secondly, helping ensure that for our member organizations that we're providing the support that they need in order to do this. It was said today that for the markets that we represent, some of them are behind some of these other markets. Some are advanced, right? Some are doing great work, but I think we're all, as a healthcare system, on this continuum. So finding out and understanding what our members need and helping to accelerate that in the work that we're doing. And then the final pillar that I'll be focused on for AHIP is identifying that industry impact goal that we'll be focused on in the coming years, and that'll be something that I have said, when I was at CMS, I would say, if we could just move CMS 2 degrees in a different direction, it'll have an exponential impact on the healthcare system. And I think that if we can move the private health insurance market, even if it's 2 degrees in a different direction, it'll change the course of how we can deliver coverage in this country. So that is what I'll be doing, and I'm taking away that there are many partners in this room that I would love to collaborate with to help think about this so we can get this right as well.
Well, thank you very much, Dr. McIver. Everyone give her a round of applause. This was great. Thank you so very much. And now I think we'll have Yi-Ling wrap it up.
So Annette asked me to give some wise parting words. It's been a very full day. I really want to thank all the speakers, the workshop participants, all the volunteers and the staff for all the effort that they've put into this. This has been amazing. I especially want to thank Annette James. This symposium is her brainchild, and what a brain she has. I I just wanted to say I think that health equity affects everyone. Whether you feel like it's affected you or not personally yet, I guarantee you it will. And so by doing this work, I think we are helping not only our neighbors and our coworkers, but our family, our friends, and ultimately ourselves. In my case, the most recent thing that I can think of where it affected me was I had to find memory care for my aging mother. And finding memory care for my mother, who doesn't really speak English that well and obviously has cultural preferences on her food, left me literally one accredited facility in the entire US to get her into, which I had to wait many months to get her into. And by waiting, I had to wait for space. So I'll leave you to figure out what that actually meant. So I got very personal with that story, and I think that helps the conversation, because the more we talk about it, the more it's in our general consciousness, and then that's going to lead to more action. And so with that, I look forward to further conversations so that we can keep collaborating and keep this conversation going. And until next time, I wish you all good health.